Hemolytic Uremic Syndrome. From Enjoy Medical Mnemonics. We will take the letters HUS, which stands for Hemolytic Uremic Syndrome, to remember everything about this syndrome. Level 1. Classic Triad. HUS. H for hemolytic anemia, U for uremia, and S for sticky scanty platelets. H. H4. Hemolytic anemia, microangiopathic non-immune hemolytic anemia, Coombs test is negative. U. U4. Uremia, hemolytic uremic syndrome is the most common cause of acute kidney injury in children. S. S for sticky scanty platelets, as the syndrome leads to an increase in thrombin and fibrin levels, resulting in microthrombi formation. These microthrombi lead to platelet consumption, causing thrombocytopenia. Level 2. Etiology. Hemolytic uremic syndrome has two types termed typical and atypical hemolytic uremic syndrome. Typical hemolytic uremic syndrome, which is Shiga toxin associated, is the classic, epidemic form of hemolytic uremic syndrome. Typical hemolytic uremic syndrome is a result of infection by Shiga toxin-producing bacteria. Atypical hemolytic uremic syndrome, which is non-Shiga toxin associated, is due to complement dysregulation in the majority of cases. We will take the letters HUS, which stands for hemolytic uremic syndrome, to remember the etiology of this syndrome. H. H4. Hemorrhagic Escherichia coli, serotype O157, H7. About 15% of infected children with E. coli O157, H7 will go on to develop hemolytic uremic syndrome. H1N1 influenza A. Hemolytic uremic syndrome has been associated with the H1N1 influenza pandemic. Histoplasmosis. Hematological malignancies such as lymphoma. Herpes simplex virus. Hematopoietic stem cell transplantation, an uncommon but life-threatening complication. HIV, a rare cause since highly active antiretroviral therapy, heart. Hereditary, both autosomal dominant and autosomal recessive. Hypertension, malignant hypertension. U. U for unknown. There was no cause identified in 50% of sporadic cases of non-Shiga toxin-associated illness. S. S4. Streptococcus pneumonia accounts for 40% of atypical hemolytic uremic syndrome. Shigella dysentery. In Asia and Africa, typical hemolytic uremic syndrome it is often associated with Shigella dysenteriae serotype 1. Salmonella typhi. Hemolytic uremic syndrome has been associated with typhoid fever caused by Salmonella typhi. Scleroderma. In rare cases of systemic lupus erythematosus. Solid organ transplantation, mainly kidney. Sirolimus, immunosuppressant drugs may cause. In the next video, we will speak about other features of hemolytic uremic syndrome using the mnemonic HUS. Thank you.